I should be able. I am the host. Why am I not able to share my screen? There you go. Okay. So if we go into history, so I have it, I have this PowerPoint where I have given the introduction, where if you guys want, I will give it to you. But basically, it's what is reflexology is basically a reflex therapy, right? Anything that reflexes somewhere else is a therapy, and that's how reflexology started. But then there was a zone therapy, which we will look into it later. Meridian therapy, which Nandini and Nitika will know more, because that is related to acupressure. We work on the meridians. Reflexology is also a method of treating the foot. Now, coming to the history, if we see, is it visible for you guys if you want to read?
Yes.
Okay. Okay. So, like I said, this is more from the ancient Egypt, where the oldest documentation of reflexology is a pictograph, where they found in the tomb of an Egyptian physician, and it's dating 2330 BC. So it is pretty ancient. Of course, in India, it is common. Like, if when people are sick in India, we take the 5 metal bowl. We put cow ghee, that is the purified butter, and we rub it on the feet with salt to remove the toxins and to remove the heat from the body.
Oh, wow.
So that's also one part of it's also a part of reflexology that we will learn, that you will see how it happens. So China, Egypt, India, everywhere it has been very ancient, and in America it is ancient because what happened is, in America it started with, I'm not able to see my own PowerPoint to read properly. Okay, you guys can view it, right?
Yes.
Okay. Okay. So basically, Dr. William Fitzgerald, he's the one who started the zone therapy. And if you think of zone therapy, probably people who have done acupressure, TCM, then we also learn the zones, right? We learn the zones of our body. So that has also been picked up from the zone eventually, because the zone therapy was something that was realized as reflexology was taken into consideration, and Dr. Fitzgerald, he came across this and he created an outline of that zones in the body. He created that. And from his work, Eunice, she developed a whole zone therapy and made it into a reflex method. So after that, actually, Dwight C. Byers was her grandson, who then made it into International Institute of Reflexology. So these are the pioneers, if you look into reflexology, where they have developed how our foot has reflex points or reflex zones in our body, and how we can heal our body out of it. Okay, so far so good. Any questions? This is just, you can find it even in Google, but I wanted you guys to know before we start going deeper into the therapy. Okay, because I know that for a lot of people, reflexology is, at least in America, reflexology is so common. Like, you will see everybody having a reflexology foot massage, foot spa. But when actually you go and get the reflexology done with them, they are basically only doing a foot massage, like a foot spa. Like, you go for a manicure, pedicure, and when you do the pedicure, what happens is they rub your foot in a certain nice massage way, and then they just put it in the water, and then put the mask, you feel good. But just doing that much, if that feels good, think about we going step by step therapeutically and understanding which part of your foot reflects to what part of your body, how you should massage it, what you should be doing, what kind of oils you can use while you're doing reflexology, and how it will help different ailments. And again, like everything else, any holistic, so this does fall under holistic therapy. And like any other holistic therapies, we always need to make sure that we are not claiming that this heals. Again, because this is not a certification course or anything, I'm not worried, but I still want to keep in mind that I'm giving you all what I would learn or I would teach someone for with certification, because that way you know what you can do and what you cannot do and why you shouldn't be doing it. Okay, so going forward, reflexology works. It does. And of course, Magdalena can actually vouch for it right now that it does work, right? Do you agree?
Yes, absolutely.
Okay, so because she has the first-hand experience, so I wanted to ask her, but what actually people think is that what happens with reflexology? Isn't it just a foot massage? So when I actually started over here, I had to struggle to convince people that this is not foot spa, this is therapeutic reflexology. It's different from what you get a foot spa, because a lot of people would not understand why I don't take 2 people at a time, why I'm not having as a spa, why I'm charging so much, why I'm taking 1 hour. All those questions were there initially, because they go like, oh, we can go anywhere and get it done. They put our foot into a water, and the watercolor changes, and they tell us that all the toxins have been removed. And that's not true. Okay, there are chemicals you can add to the water which will change the color depending on your body's temperature, your body's mechanism. Like, some people sweat in a different way, some people have a different kind of sweating, some smell, some are very more salty. So when you dip your foot in that water, it's going to change the color. It does not mean it's removing all the toxins. Yes, there is a different technique in Japan where they have a different way of saying that this is reflexology, but they have particular kind of herbs that they compress and put it on a sock, or they make it compressed, and then you wear those socks and the toxins are removed. There is a technique, and that is true, just like we are going to see in reflexology. So the principle of massaging the reflex points is basically to release endorphins. And what are endorphins? They are our natural painkillers of the body. Once you release them, you automatically start feeling the relaxation. Okay, a lot of times I experience that when they come to on the table, and as soon as they are on my table, within 5 to 10 minutes they are like almost snoring, and I go like, okay, the snoring time is after 10-15 minutes. Let me first ask you all the questions while I am working on your feet. So that is what you will be learning into our class, that when you are touching certain areas, when you're massaging certain areas, what questions would you get in your mind, and what should you be asking who you're massaging. And the other thing that I'm going to do here is actually, I initially started this where to make this class into self-reflexology so you can treat yourself. I ended up making it for self and for others. So that's why I said you guys are going to get the maximum out of this, because I didn't know how to condense my work. So gradually, maybe I will learn how to. Anyways, but I'm happy to share it. So what happens is, why and when do you do actually reflexology, and why it works? Because one thing, as I mentioned, that we release the endorphins from our body, so we have a natural painkiller, and what it does is it starts to restore the energy in us, because now once the pain is less in your body, your energy level goes up, which we all know it's natural, right? Even if you go for a massage, why do we feel good? Why do we feel good for a body massage? Is because all our muscles, all our um, veins and everything, like, each and every part, our bones up to the bone, we feel tired, we have that fatigue. But the minute the massage starts to massage the muscles, even lightly, or they have a light touch and they start rubbing, you're relaxing. Everything starts to relax. And the same thing happens with reflexology. Reflexology is a very, very good technique, especially for people facing emotional trauma. It's very, very healthy for them. It's very useful for depression because it flushes out a lot of your toxins naturally. And now when I say toxins, it's not that colorful water. But what happens is, because you're relaxing, what will happen is you will either go pee a lot, you might sweat a lot, you might sleep a lot, there might be different ways. Some people vomit, you know but the two extreme is vomiting and sweating. So when there is too much sweating, or when there is a vomiting, that you are actually, the body needs a lot to come out. The body needs a lot to get out of the system. And there can be other issues in the body, but at the same time there can be nothing. It can just be the one time thing happening to the person. After that, if it again keeps on happening to that extent, then you must let the person, or you, if it's happening to you or your loved ones, you should definitely make sure you're getting your full body checkup once, just to make sure that there is no severe underlying issues in the system in our body. Okay, so a lot of times what happens is, because you are pushing and you are stimulating all the toxins from the body to surface, the body starts to show a lot of different um, reactions of toxins, like I just said. Okay, and that's when you need to be careful, because a lot of times some people, like, if you do reflexology on them, they feel very good in the beginning, but then they say, like, what, I started having so much sleep and I can't wake up. I'm so tired. I'm constantly tired after doing your reflexology. And that's normally because that body really needs that rest. Okay. And when you, so for you all, because as a beginner, I would always suggest, if you see any severe reactions, I would want you to stop the reflexology and let them go to a doctor to get a good checkup. But you should definitely let them know that there is something more underlying, which is out of my hands, something that you need to go and see a doctor. If you are an experienced certified, you know more deeper about it, what you can reverse it, what you cannot, then you can go and do it in a different manner. You can, like, I know, Magdalena, you're a masseuse, so you know what kind of massage will relax them, what you do not want to do anymore with them, and how you can make them feel more relaxed. You know, you won't go into the deep tissue massage. You will make sure you're giving them just a very soothing, relaxing massage. Instead of going into the reflex points, you're going to just overall relax them. Until and unless they start feeling. So you're going to not go deeper into all these massage versus Nitika and Nandini, because you both know acupressure, then now you know what might have been happening, because now the symptoms is going to tell you that this is related to this kind of organ you know, underworking or overworking, and then you can do the sedation or tonification accordingly. So when you come to that level, then it's okay. But otherwise, if you feel that the reactions or the effect of reflexology is more into deeper negative issues, then we call it negative because when you don't know the complete reflexology part, then you don't want to go any further with that. You just want to stay to the low superficial level of it. And I'll show you both everything we will be talking about. So again, it's, you know, flushing out toxins and stimulating the energy flow, right? What are the benefits of reflexology, which I have almost I did speak about it. The benefits are, you know, the relaxation, manipulation of the muscles of the foot, pain relief, stimulation of the immune system, psychological comfort, nerve stimulation, encourages the body to heal it, because once your body is relaxing and you're removing the toxins, naturally your body is going to heal. Okay, because you're having improved circulation, your muscle tone improves. All these improvements are the benefits of reflexology. Now, what are these 8 bodily systems that we are working, and what are we balancing? So when we do reflexology, what are we doing? We are actually working on the spine. In my experience, I have seen that people have come and told me that since I have started coming to you, my posture has changed. And how does that posture affect us? It's the spine, right? We all know our posture is basically our spine. That's how your posture gets better. Your muscles in the neck. So when you massage certain areas, the muscles in the neck starts to release. They start to get more circulation. So that also is one of the things. Your lungs breathe better, your brain functions better, because now you're getting you know, endorphins released, you're getting the adrenal glands are being stimulated so that your adrenal goes high. All these things starts to your heart, your bladder. Everything is a combination. As we know, one affects the other. Okay, so these are main 8 parts of the body that is affected. Okay, so this is where we are coming to the zoning part. Okay, so I have this foot here. Okay, so this is what, if you guys would like to draw, like, you know, you come to, you're doing this center line. This is going to be the top line. So do you see, like, under the foot, on the big toe, we have this embossed area of the muscle, right? From here to here. So there is a dip, and then you go like this. So this is the top area. So if I show you in my hand, and if it's in the foot, you have this the bigger, under the big toe, you have this big muscle area, right? Right. So if you
Yes.
all guys want to fold, I will try on our second day. I'm going to try and see if I can actually not show my face, but show my foot. and I can show you how you can do the massage on yourself. So once I do a little bit of it, and then I will come back, show my face, and then you guys can show me what you understood from that. Okay, we'll try and do that tomorrow. Okay, so again, so this is the foot, right? If you do, so if I go from here, there is a dip here, right? In all our foot, you will see there is a dip here. And from there, again, it starts to become like a bigger, like, you know, the swelling, like the muscles. So that's what the arch I'm showing right here on my diagram.
Okay.
So do you see, like in each foot, like you're going from here to here, and you're going from here to here. That's the area right under the big toe. Yeah?
Yes.
Okay. So that area, so now you know, see how I said, so these are all where your head, okay? So all of this will be your head in the neck area. Then this will be your shoulder and your chest area. The reason I will come when we go deeper, you will see more about it. So when I am here, I am actually working on your chest, and then as I'm going to the sides, I'm working on your shoulders. Okay, let's do some practical before we go forward. Take your foot in your hand, like, you know, fold, and then massage over here. Just your big toe. Massage your big toe.
Yeah.
And then this is your neck. So what you're going to do is you're going to pump and massage, pump and massage. You're going to pump and then massage, pump and then massage around the neck. Tell me if anybody has any neck pain, see how you feel if your neck starts to relax. You're going to use the bed of your fingers, the thumb bed and the fingers. You're not going to do point, you're going to do your beds, finger beds.
Is it circular motion?
You can go circular motion, you can go pump and massage, pump and massage. Yes, Nitika?
With my regular persistent neck issues, I'm having pain in this region.
You're having the pain on this area? Yes.
On the neck region.
On the neck region, right?
Yeah.
Yes.
Yeah.
On the neck region, right here. Okay. Yeah. So when you massage the toe, okay, so you massage your toe like this and give a little twist, just a little twist, but go from the bottom of the big toe.
Yeah. Yeah.
Do you feel a little release? It's very less because you're doing on your own, right? And that's why I want to also start showing you that once you do it on your own. See, I do it for everybody. Sometimes when I'm tired, I want someone to do it for me. I don't have. So all I do is I rub my big toe for so long till actually, you know, for someone else, I'm doing it for 2 minutes. For myself, I do for 5 to 7 minutes. And that's when I start feeling, okay, now I'm fine. But the best way I do is when I'm taking a shower, I stand and then I rub my feet on top of each other. And with my heel, I press on my toes. So my spine is also getting some release. So I do that. And that's what I'm going to teach you when you can do on your own too. So in your figures, actually, you might see at the end, you will see like the two feet are one over the other. You will see that they are like this. You know, there are figures that I have given that we will go through step by step. But I want you to see like how you feel. Now, you also have shoulder pain, Nitika, right?
Yes.
Okay. So now rub on the little toe side.
Yeah.
So on your little toe, you're going to give a good nice massage with your bed, not tip, okay? So you can also use, now this is not a Jimmy that we use for acupressure, but this is, this is when I learned the thigh massage. So we call this a thigh pen.
Okay.
And what we do with this is, if it is some very fleshy area, we use this blunt part. And for the smaller areas, we use this. And I think you find this on Amazon.
Okay.
I got it from my teacher, but so if you take something blunt and you just massage slowly around here, like your little toe, and you press here, it should come up to here under the bone, and you start massaging. See what you feel. If you have shoulder pain, you should feel a release in there.
Right now I don't have, but I think when the
Sorry?
neck, right now I don't have shoulder pain.
Okay.
At this moment, but neck was definitely tired, so I'm feeling better there.
You're feeling better. So
Yeah.
with the neck, if you are having too much of neck problem, like if you, like what you have, I know what you have. So if you have a lot of neck or C-spine issue, what I would do is not only just rub here, but I would even go a little bit deeper, like with a blunt one between the crease of the toes. So it would be inside, right?
Yeah.
And when you do that a little bit, you will see that there is much more relief. You will start feeling much more relief when it's more severe. So far, any question?
Does it matter? Can you hear me, Smita? Yeah.
Yeah.
Does it matter? Excuse me. Does it matter which foot you're working on?
No. So
Okay.
you are going to always work bilateral. For ladies, you're always going to start with the right foot. For
Okay.
gents, you're going to start with the left foot.
Why is that?
Because we are our dominant
Okay.
is right and men is left.
Oh, I did not know that. Okay.
So the system starts to go from left to right in men, and for us it goes from right to left.
Mhm.
Ladies are anyways always right.
That's
Yes.
right. I'll remember this. This is going to be easy to remember now.
Yes,
Thank
women
you.
are always right. Good. So so the top area is the head and the neck. I already showed you the neck.
Yeah.
What about the head, right? I didn't talk anything about the head. These all tips, when you rub these tips even a little bit, and especially, of course, now in India, it's very warm, I think, but over here, we are still having cold, right? We still have that chilly winter kind of, atmosphere or weather. So a lot of us feel that clogged nose. We feel that sinuses are, acting up. You just pinch this and you push this. So it's the tip of the toe in the center. You're going to massage nicely every toe. Every toe, you're going to do the massage. Again, I'm just using this so it's easy for me to show it on the model. You don't have to use this. You can use your hands. But if you feel you're doing a lot of reflexology, you can always take a tool because it will save your thumb. You can, all these tips you should massage. Once you massage these tips of both, and you also give the pressure points, after 2 minutes of each, the duration should be 1 minute, maximum 2 minutes of massage. Each point should not exceed more than 2 minutes. We have to be careful about that. We don't want to overstimulate any point. Okay.
So is this good for like a migraine headache?
It should be good for migraine headache. So for migraine headache, you're going to do is you are
Oh,
going
okay.
to go on the top of your foot, right? And here is your occipital, right? So you're going to start massaging around your nail bed, and then you're going to go like this. So even Nitika, this is also the C spine over here. So
Okay.
when you go here, and this you know already, I think.
I already got the muscles relaxed. There was a tuck tuck sound and it's relaxed.
Awesome. Yay. That's good. I'm just checking if someone said that they are not coming.
Testimony.
Good, good. I like when we, and that's why I wanted to make sure, you know, like if we at least have 5 people in the class, then it's more interactive because 1 or 2 will have something that people can see that there is some difference, right? If we are having just 1 or 2%, I mean, you will still learn a lot, but then I will be going fast and I don't know if the other person will enjoy me talking all the time. Okay, so the migraines, you got that, Magdalena? So if you do this around here and also you do the tips of the toes, because the tips of the toes, sometimes your migraines are because of the sinuses. You never know. Okay, so that is why, see, when you're only doing reflexology, it's hard for me to separate now because it has been years that I'm doing a combination of modalities. So to separate everything was very difficult for me to do the PowerPoint to separate. Oh, you know, I don't need to give this to them because they won't understand, because I just want it to be reflexology part, right? But luckily today you guys are in other professions also, or you know other therapies. So that is a good thing, you will understand it. So the head part, now you got it, right? The tips, sinuses. So a lot of times when I do and I start, and after 2 minutes, I ask them how you're feeling. You know, you have to make sure when you start, you just don't keep on doing what you're doing. But once you finish your one area, so now you finish your head and neck, now you're going to just make sure you're asking them how you're feeling. Most of the time, they will say relaxed. Yes. Any question someone asked?
Each part we should do, yeah, each part we should massage 2 to 3 minutes.
Yes, not 3 minutes. 1 minute
Can
you
you
can
hear
do
me?
each. Yes. But see, the thing is
2
that you
minutes.
don't, right now, just note it 1 minute, right? Once you start doing the whole foot, you're not going to stay on one point for a whole minute. But if you keep that habit, say for example, today, if our class ends by the time we are done the lower abdomen, so I'm only giving you the sections. Try practicing on each point that you remember for a minute and see how you're feeling. But once you are doing the whole foot, you will see that the whole foot should be done within 45 minutes. Okay, and then if I'm talking about all the points, there are going to be about 48 points I will talk, right? So if I'm talking 48 points and I want you to finish in 45 minutes, meaning you're not going to do 1 minute each point, it might be less than 1 minute. Actually, there are 106 points, but I combined everything to make it, because then it becomes redundant to keep on telling you. So you will see those points in the coming up classes also. So so this area we covered, neck and head, right? So immediately, a lot of times people say that I don't know how I feel, but I know I'm breathing better. So a lot of times they don't know what they're feeling, but they do realize that their breathing has become better. We haven't even touched the chest area yet, right? We haven't even gone to the chest area, but just their head and neck, because it also covers, this area covers eyes, ears, nose, neck. It covers the thyroid, thymus, parathyroid. All these are going to, you will be seeing that they come under the upper area. Okay, so that is why they start feeling the relaxation in the breathing. Already they are feeling that goodness, the refreshing in their breathing. And once you start breathing better, what happens? You automatically feel better, right?
Right.
So now we're going to go to
It's
the
funny.
shoulder.
Can I just say something real
Yes,
quick?
yes, absolutely.
I was just thinking, we were rubbing the feet, you know, the taps of the finger, not
Toes.
fingers, toes. Yes.
Yeah.
And I had to go and blow my nose because it just started running. And now that you just said that, you know, I'm like, okay, so it's releasing.
Yes.
Yeah, that was great.
Yes. So that is, and it is an immediate effect. So then now, you know, like that's why I put that bulb there, that it does work. Reflexology does work. And it's very, very instant, because it's going directly to the zone where it needs. And once you learn the zone, everything will start making more sense, that why, you know, because a lot of times, like, you know, you guys have that, when you rub here, how can it relax here? Why does it make me feel better? Why does I feel like I am doing a better job in breathing? You know, things like that. Of course, you are going to add a lot more to, if you become a therapist, then you're definitely going to add more and more to it. But right now, even to learn the basic, just the basic of reflexology, and if you just understand what and how you will be rubbing, you're already at basic level of reflexology. You can start doing that from today, you know, if we finish the whole this chart right now. Okay, thank you, Magdalena. That also gives, you know, other people, and that's why again I said, like, Nitika shared that her neck started releasing. You said that your nose started running. So people know that this happens. It's not just something that we are saying, it really happens if it's done. Okay, so we are now coming, and the shoulders, like you see, I put arm here. So this is where the arms are. So here will be the shoulder, and then the arm goes down. And that's why I told you to rub this area more if you have shoulder pain. Okay, so from the little toe towards this part will be your shoulders. Okay, and now the shoulder line and the chest line. So now we saw already, right, from where I told you, from where we are dividing this part. And now this part has already been done. So we are left with this part. Okay, so this is your shoulder line and chest. The reason is, when we have our chest area, of course, the shoulders are attached to it, right? So we are going to take the shoulders, and then this is the chest. Then this is the most important part, because once you do this, so you hold like this, your chest area, and you let it go in. So if I am doing if I am doing reflexology on your foot, my thumb bed is right in the center where the depression is, between this muscle and this big muscle, and in between, right? There is a depression here. So you hold this 2 to 3 fingers, and you just press. Okay, so if I am showing you, I'm doing it like this. Basically, this is what is happening is I'm pumping your chest. I'm pumping your lungs area. Okay. So normally what I do is once you go from your shoulders, you did your, and then you go from here, you're going to do, and then you pull the toe, I mean the foot, and you come depress. You're bending it like trying to bend. Of course, your foot is not going to bend, but you know how you're compressing from two sides. So with this, when you do the whole area, when you start rubbing this whole area, you start feeling the release. But with that, what you want to do is you want to breathe and relax. When you're massaging, right? When you're massaging, you take a breathe, you press, and you relax that whole diaphragm. So you're going to do that, like when you do that and you breathe, you start feeling it, and try to do it on both feet, one by one, because then you will see the difference. Right now, your one foot might be feeling so relaxed and the other foot might be asking you, touch me, you know. It happens a lot. If you're doing on your own, it does happen. So actually, I'm going to request you all that I had mentioned what materials you should be having handy. I would like you to guys to keep either a lotion, some kind of oil, something handy when you're in the class. That way, when you're rubbing your foot and when you're trying out any practicals, it's easy for you to rub. Because when I'm seeing you putting that pressure, the pressure that you're putting is not what it needs. It has to be soft and it has to just keep going like you're massaging.
Okay.
But not deep tissue massage. It should be a massage, just a massage, okay? With your bed, the finger beds.
So when we are doing for ourselves,
Yeah.
we use the thumb or the fingers.
So when you're doing for yourself, you're always going to use the finger beds. That's why I showed you like this.
Yeah. Okay.
Like this. But if I'm doing it to you, then I'm taking my thumb. Yeah. Because that's the only way you will be able to do it in a better position. Otherwise, it would be very difficult.
Okay.
Right? So, and again, you know, the chest area and the shoulder area is not an instant. You won't see something instant, but that is how you're going to start relaxing. This part, the head and the neck part, is one of the biggest thing, is because that starts to relax them. Then you come to the chest area and the shoulder area. So now you're relaxing the other areas and now you're letting them breathe better. So they start breathing better. And then we come under the diaphragm, and that's right where the depression ends. You know, this is the diaphragm, right? Under the depression. So if you're looking at, and that is the largest area, okay? Because it covers this area, covers up to here. So see, this is the largest area that we are covering. Why? Look at ourselves. This is our chest area, right? Like if you can see your chest, and then below the diaphragm and up to the pelvic area, if you go, that is our largest area. All our organs sit in that area, right? Right? So what is just the abdomen is not just the abdomen, right? You have your gallbladder, your liver, you have your intestines, you have your uterus, your ovaries. Everything is between the pelvic line and the diaphragm line, correct? So that's when you are going to become, and that part I'm going to show you more slowly, because here you're going to touch a lot of different organs, okay? And you're going to do it in a one systematic way so that you're releasing and you're massaging your intestines so that bowel movements become better. That's the reason when you do all these areas, you normally want to go to the bathroom. So most of the time after my session, people want to use the restroom right away. Okay, so because we are going to massage around here, if it's your left foot, what I will do is I'll also send you a chart so you can take a look at the chart by tomorrow, so you will know what all is coming in that area. Okay, so because in the left foot it will always be the heart coming here, okay, and in the right foot it will be the other organs, you know, like the spleen and liver and those organs. Of course, kidney comes into both the foot because we have two kidneys, so they are there. Of course, the kidney is not in our by our abdomen, the kidney is in the back, but we reach the kidney from here.
Yeah.
We do reach the kidney from here. And yes, you guys know kidney 1, right?
Yeah.
K1 is right there. So, so this is where we are going to work in a very systematic way and not just keep on massaging the way we want. This is where we are going to take a little more time to go slow, to work in a more systematic, slow manner, asking. If you're doing it for someone, you're going to make sure you're going to ask how they're feeling, if everything is okay, if the pressure is better, if they are feeling, you know, the comfort level is there is no discomfort. Okay, so when we come to this area, we are going to go little slow. We're going to learn a lot about this area, okay, because we have a lot of organs over here. And then we come to the lower abdomen. And of course, because the pelvic area ends here and the lower abdomen, but we, you know, we cannot just say that the pelvic area ended, so there is nothing below it. There are other things below it, right? The funny thing is then things go in the side. So who remembers what I told to do in this area?
Yeah, I did it
Yes.
for
Yes.
ovaries,
So,
uterus. Yeah.
yes. So we come to the ovaries,
I'm doing
uterus,
it
the testes.
regularly.
Yes. So when you massage this area, again, we have to be careful because these are our sensitive organs, and they are our organs that we need to be careful. In the notes, whenever you refer my notes, I have mentioned menstruation. During menstruation, during pregnancy, you don't do massage, you don't do reflexology. I still do it because my level is different, because I'm helping them. But if you are doing it, or if you start understanding more and more, you can do it. Pregnant women, try and avoid it, because you don't know what the pregnant woman is going through. The hormones are different, changing. Do not do anything. You can do a little bit for the first 3 months, but after that you would not do any kind of reflexology even on them. Okay, if a pregnant woman is really in pain, then I very lightly do the massage here so her bowel movements get little better, but that massage is like a baby massage. the way you do a massage on a baby. Otherwise, you don't do it at all. But this areas also, these are very sensitive areas, but once you start rubbing these areas, then you can really regulate. So for PCOD, this is one of the good areas to work on, both sides. Okay, so we will come there. These are the areas. You come to the spine. So this is the spine. So here I'm saying this is the leg. I forgot to write here. Okay, so this area is the spine. You can see where I'm moving my cursor.
Yeah.
Okay, so excuse me. So this is the spine, and just like our spine, right? See how our neck goes little front, and then our spine, and then in the coccyx again it curves, right? Again, it's curving at the coccyx. So if someone has really sharp pain here, then you know that they are having something going on in their tailbone, or maybe they might have fallen, or they have some injury for whatever reason. 1 second. Okay, I will. Okay. I thought someone is telling me that they are late in joining. Because now the class is already 8 o'clock. Okay, so the spine, you got the spine, right? And then you come here. This is the sciatica, like, you know, where our bone, like the ankle bone is, and then the depression of that whole, like you pinch here.
Yeah.
In by just the heel and above. So when you pinch there, that's where your sciatic nerve is, the sciatica. So if you massage over here, a lot of times they feel very good in the whole back or the lower back. You start feeling good because your lower back starts to relax.
Okay.
Okay. Okay, so far so good. Everybody understood it?
Yes.
Nandini, we're asking something.
No. It's
Okay.
clear.
Okay. Okay. You're massaging? You guys are massaging your spine? Yes?
Yes.
Yeah.
Yes. It's fun. Trust me, it's fun. Once you learn, teach it to your husband, to your kids, and tell them that, tell me, see how you are doing. Let me see if you're doing it correctly. You will enjoy it.
Just give me a minute.
Sure. I hope this this dummy is helping you guys to understand better, right? Okay.
Yeah.
Okay. Because I know that if I show my foot, I won't be able to talk properly or show properly. So I think this is the best way. See, I had to figure out how I can do it online versus teaching in person, you know. Teaching in person will be more different because I can show the practical, I can show it on them. But when I'm doing online, it's, I hope this is helping to you
Yes.
guys to understand it.
Yes.
Good. Okay, so we got this. What is this? Let me close the stop sharing. Wait.
Yeah.
Okay, so this is
Head.
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 Mhm.
Yes.
The neck area. Mhm.
Yes. So this is also
cervical area.
cervical.
Neck. Okay. And then,
The shoulder.
Shoulders,
yes.
right.
So what if I'm doing it here?
Chest area.
That is chest.
Chest area. And see, now that we don't have that screen, you can probably see. So now if I do this, actually this is our solar plexus. So whenever you work on your solar plexus, you naturally going to feel more relaxed. Okay.
Mhm.
So what area is this now?
The diaphragm, I think.
Diaphragm line.
Yes, right. So this is going to be the diaphragm and this like this. So this is the solar plexus
Mhm.
right here. Okay. Okay. What is this?
That's the spine.
Yes. Yes. So the inner side by the big toe is the spine. You keep going,
Down.
right? What things you will see here from here to here?
So that is abdomen.
Abdomen.
So abdomen
Abdomen.
will have the
Yes.
basically our stomach,
Spleen,
liver,
liver,
Stomach,
heart.
liver.
large intestine, small intestine.
Yes. Yes.
So you
So
said each side will be heart, and on the kidneys will
side.
be on both feet.
right. Right. The left will be heart. Correct. If it's your left foot, you're working on your heart. The reason you want to know, see, without knowing, if you keep doing, that's fine. But if you're working consciously and you know which area is related to what, then you will be able to actually even start to understand what is going on in the body. Okay. So as I said, you guys are going to really get a lot from me. So, you know, basically it's like diagnosing someone having some issues. Like a lot of times they go like, how do you know I have this issue? How do you know if so, you know, I keep asking, are you having some constipation? Is your lower back really hurting? You know, because you're consciously working on that area, you will start seeing, you will start feeling the difference in that texture of the muscle or the foot you're touching. Okay, so we will talk
Mhm.
about that also as we keep going and as we do more practical. So this is your
Fine.
spine, and then if we come here,
This is the end of the abdomen. This is lower abdomen, and
yes, so the spine, and then if we go like this, the spine goes curve up,
coccyx.
right?
Yeah.
Coccyx, yeah. Okay, so that is what it is. And then what about this line? We haven't talked about this line, right?
Yes.
So this one was
arms.
arms, yes. And so we worked on the shoulders over here more, right?
Mhm.
Okay, then as we keep going, what will happen here is your arms, and then you come
Side.
to what, sorry?
Sides of the trunk.
Yeah, so yes, so you come to the side, but now what actually is happening is instead of the trunk and it's the side, but what do you get? Like this is one part, there is a bony part in the center of your
Mhm.
foot. Everyone might will have that one bony part, very teeny tiny.
I can feel it. I don't know what it is though.
You can feel it, right? So this and this, so when you go here, it's still your shoulders and your elbow and your knee, all those joints, sorry, the elbow and the wrist, and then this, and then when you come below
Mhm.
that bony part, then it's your knee, your ankle, your
Mhm.
hip. So all these area around, most of the joints that in your body, that's what this is. So when you massage this area, the center part here, you will start feeling the difference. So if someone has something going on in the hip, okay, a lot of times people come with bursitis in the hip. They come, they go like, oh, I can't sleep on that side. I'm having so much issues, and the doctor is not going to, not able to figure out. I can't sit too long. It's hurting me. You know, my glute starts to hurt, all these things. You start massaging over here and this area. So they will start feeling the whole relaxation, because every joint, and every joint is always having a ligament, a tendon to hold those two together, right? Hold the joints together. So you're going to really see a lot of relaxation. So you're actually working on this whole area like a mountain. This is like a mountain, and then you're going like in a triangle. You go from here to here, and then you go from here to here. Once you do that, you will see how much difference you feel. And then as you keep going lower and lower, this is again going to go into the, you know, testes or fallopian tubes, and uterus, and all that area will come to. Okay. And then what is here?
Did you say sciatica, or is that?
Yes.
Yeah. Okay.
Yes. So the sciatica is always going to be like, there is, if you massage from here to here, why from here to here? Anybody can tell me? What is here? The coccyx.
Oh, right, right. Okay.
That's okay. Today is the first class, don't worry. So the coccyx, right? And what happens when we have sciatica? You know what happens?
Yeah, that the large nerve that passes through coccyx to the calf muscles from the back, that that has a hindrance.
Right. So actually sciatica has 5 different nerves. Sciatic nerves can go through 5 different areas. It can go from the front, it can go from the side, it can go from the back, and it can go from the internal. So sometimes some people, they feel so much pain in their back. They cannot do anything, and that whole back is caught. Like, you know, you will feel that pain shooting all the way up to the hip. You feel it in that tailbone. You feel it. Some people have severe pain, but more towards the pelvic area. So in the front. So it goes from the back, but it comes to the front. Even that is a sciatic pinch. So the sciatic nerve is usually ending in the coccyx, or actually it's generating from the coccyx. And that's the reason why the sciatic nerve feels the relaxation when you actually massage this area. When we pinch this area, it feels good, or we pump this area, it feels good. And lot of times, let me warn you, lot of times if you do it too hard, someone will actually say that their back pain increased. Okay, so be very careful when you're doing this massage. And that's why practice first on yourself, or someone that you know you can practice on, who is around you all the time, before you even practice on someone else, like outsider.
Yeah.
Like a friend, even if it's a friend or someone. You don't want a friend to tell you that, oh man, you gave me a very bad back pain. Right?
Right.
So when you are massaging this area, make sure that your pressure level is not so bad that they get a bad pain, you know, because sometimes, you know, when we were learning, we thought that if we press, they feel better. So we go press, because they are not saying anything. They are not even reacting. But you learn the hard way. Sometimes it's like you press so hard, and then when you're actually practically learning, you have to do it on outsider. Actually, I don't know about India too much, But in US, when you're learning, and once you have completed, then they give you clients. So the students will be working on you. So that institute will get, like, if normally you're charging $70 for a therapeutic reflexology, if you go to the school, they will let the clients come in and pay you only $20 or $25, so the students work on you. And that is when we learned the hard way that someone gets a pain, that, okay, you did something wrong. You were supposed to release the pain, not cause the pain. Okay. So the sciatic nerve is kind of interesting, but very important also. People who stand a lot, wear a lot of heels, walk a lot, when you massage this area, they really feel good. They really get such a relaxation when you do this. Okay, so any questions? Anything that you guys feel that you have a question, or for tomorrow, practice a little bit. We'll go more deeper. I'll send you the chart, and tomorrow we will be starting to work on each making, I want you to start doing, keep your oils or your lotion, something that is, try and get something that is more oily or lubricative, so that you can actually use it for a longer time. I normally try and use castor oil, and I mix some aromatherapy oils to it, and that I will give you tips on aromatherapy oils also, that few of them that you can use, different kinds of oil you can use. But for practical for tomorrow, try and keep some that kind of oil. Lotions might, after sometimes when you keep massaging, the lotion will disappear again. You will have to apply the lotion. So but feel free to use whatever you like on your feet.
Okay.
Okay.
After massaging for 45 minutes, how do you feel? Will you have any side effects like shoulder pain or cervical pain? If we
If
massage too long
we
for
must,
someone,
oh,
yeah,
me, for me,
yeah, yeah,
no,
I'm a,
no.
no.
The reason is, when you are
Mm,
massaging to someone else, you are not using this part at all.
okay.
You're only using your bed, nail,
Mm,
finger beds and your nail bed. And that's why I said that sometimes my thumb gets tired. So if you see my thumb, here I get pain. So I keep on doing this all the time, this part of it. But then sometimes then I start using the stick, the thigh stick, because then it helps me to go, I can use the blunt area. Already the oil is there, so I can just keep massaging and I can go. But it has not happened to me.
mhm.
I used to do health fairs for almost like, sometimes I open at 9:30 my stall, and at 5:30 the organizers have to request me to close it because there is still a line. But because that I'm not only doing reflexology, but I'm also doing the Sujuk one. So some wants to get that and some wants to get this. So there will be a huge line because they're getting it for free. So even after 8 hours, actually, I don't feel any kind of pain, or I'm not tired.
Okay, okay. But one lady suggested that if you do reflexology, you will have side effects. You will have cervical issues. She said, "Don't learn it." That's why I'm asking.
No,
I want to
that is,
clear.
if you're doing this reflexology, then it
Okay.
might happen,
Mm-hmm.
because then you are pressing, what you're doing is you're taking your shoulders and you're doing this.
Mm-mm.
Then everything is getting tight, right? What you're doing is, see, if I am doing reflexology on you, my hands should be relaxed. My thumb and my hands, the palms, should have most of the pressure. So if you know how to do the pressure, and just use your fingers and use your thumb, there should be no way that you get a pain in your neck at all.
Okay.
Even for massage. Magdalena, you're a massage, so the same thing probably applies to you, right?
Absolutely. It's all about my body mechanics and knowing how to use your body.
Yes, yes.
Mhm.
So even, you know, some people say that, oh, I don't want to become a massage therapist because, you know, I'll be tired. But if you're using a certain way of doing your massage and you
Mhm.
know the techniques of it properly, then it will not happen. Yes, when you're learning, when we were learning, yes, you know, when we are like, okay, we have to do, and then the teacher comes in,
Mhm.
okay, relax, relax. So
Yes.
so we get tapping over here, relax, relax. That's the tapping that we get. So we remember to relax our shoulders and neck, and then we just relax. And you have to be in a comfortable position. That is very important. If you're standing and you're doing it with you know, you're having a, say for example, like sometimes I get a 6 feet 250 pounds person sleeping on my table, and he's a man. So when I'm massaging his foot, of course, you know, initially I have to first make myself very comfortable, mentally be prepared that this is only a massage of the reflexology, foot reflexology. I'm not doing anything else. I don't have to find pain points, right? If I have to find pain points, then I have this, or I have my Jimmy. But if I'm just doing reflexology and I use gloves, whether, I mean, in school we were not taught about gloves, but even before the pandemic started, I have started using gloves, because not that I don't like to touch the feet or anything, but not everybody comes with a clean feet, because over here also, or even in India, right, people come from outside, they're traveling from far, they come from work, you know, they don't have time to go and wash their feet and everything, and you don't have that kind of facility that, oh, please remove your shoes and socks, and here there is a fancy spa bathroom, go and wash your feet. You know, we don't have all that. So you just wear your gloves, you clean their feet nicely with any, you know, wet cloth or anything, and then you start with your oil. That's why I said use oil that is more lubricative, like, you know, having more lubrication on it. It's lotions can be absorbed easily, and then you'll have to keep using it. As soon as you feel that it's not moving smoothly, you want to take the lotion. Okay, Nandini, you get my point, right?
Yes, yes, I'm clear
Okay.
now. Okay.
Yeah, no worries. Make
Okay.
sure your shoulders are always relaxed though.
Yeah.
That is very important, very important.
Okay.
Yeah, yeah, we'll do this exercise. Any other question?
No.
Yeah, so Smitaji,
Yeah,
we've done the shoulder, chest. What about the scapula and all? Will we be covering that tomorrow, or that's on the, because I understand that will be on the other side of the feet?
it is on the other side, but actually when you do the shoulder area, when we do this shoulder area, and when we do the chest area also here, you know, you're, because you're touching here, whether you like it or not, right? Even if we don't want it, we are touching these areas, they automatically work on the scapulas in the back. And then once you do the spine, it also again relates and it also relaxes.
Okay, okay.
Okay,
And the spine would be the inner side,
inner
right?
side.
Inner
Yes.
side.
So from the big toe, it'll come up to here will be the C spine, then will be the thoracic, and then will be the lumbar and the coccyx.
Okay.
So from lumbar, it will go like this, and then the coccyx, sacral and the coccyx.
And this up, the line along with the thumb, the upper side, upper side. Yeah, this one is?
This one, so this one right here, we
Head.
start with the brain. So brain,
then we go
and
down,
then like a little bit below, right here, and then you come up to here. This is your C-spine.
Fine. No, I'm saying the front region of the feet.
Oh, this one?
Yeah, this line, what will be
Yeah.
that?
So this will again, this is again your C-spine, but what will happen is now we are going into occipital. So now you're working on the back side of the spine.
Okay.
Only the C-spine. So when you work on these areas, this shoulder, the shoulder will automatically get covered. You know what I'm saying?
Got it. Yeah.
Okay. Yeah. So once you start working all these areas, you will see that you will start feeling the relaxation, because even this will, if you look at this, is your occipital, right? So this is here, and then you go from the neck, and then you go below, then we come here, right? So that's what is happening. You're coming here. Make sense?
Makes sense. And in this reflexology also, do we have, we have to go bilateral, but let's say the left shoulder pain. So do we have to be specifically on the left side of the right foot and on the right side of the left, primary, secondary? Is it there?
No.
Or
here the zones will be on the same side. So you're basically going with the zone. And once we come tomorrow to the zone area, you will see what it works is there are 10 zones, but the 10 zones is all because it's 1, 2, 3, 4, 5, and then the next, the other foot, so the center is there. So when we are working here, we have to keep in mind that this, like if it is this zone, because it's kind of, the zone will go like this. It'll start to taper towards the head. Okay. Then it starts to spread, and then it again spreads from here down to the arms. Okay. So what I will do is I will send you the charts today. I'll send that chart, and I'll send the zone chart also. That way you guys can take a look at it, and then tomorrow you will be more, it'll be faster for us to understand, and then that way Wednesday we can have more doubts cleared, and we will not have to continue for one more day, hopefully.
Sure. Okay.
Any other question? All good?
For now, I'm good.
Okay. So in my class, any class that I conduct, what I want to always do is I don't want to end it like, okay, bye, see you all tomorrow. I want you all to do a little breathing and relaxing, and then we end the class. Okay. So let's all gather. If you want to close your eyes, close your eyes. If not, just do a light, gentle breathing. Slowly inhale. Feel your breath. And gently exhale, feeling that exhalation from both your nostrils. No need to do deep breathing, just gentle breathing. Follow your breath. And now you're going to count. At the count of 4, you complete your inhalation. 1, 2, 3, 4. Slowly exhale. 3, 2, 1. Relax. Let's do it one more time. Inhale. 1, 2, 3, 4. Exhale. 3, 2, 1. Relax. Just breathe in and out, feeling your breath. And now rub your palms till they become warm. And once they are warm, I want you to put it on lightly on your eyes. You can take off your glasses if you're wearing glasses. Just cupping your eyes and slowly with your finger beds, you're going to rub your temples and your forehead, coming down very lightly and slowly. Just join your hands. Om Shanti, Om Shanti, Om Shanti. And now we can end the class. Stay blessed, stay healthy, and stay happy. Have a wonderful day, wonderful evening, guys.
Thank
See
you.
you guys tomorrow.
Thanks.
See
Bye.
you tomorrow.
See
Have a good
ya.
one. Bye.
Bye.